Okay, perfect. So it looks like we are live now, and we'll just wait for individuals to join us. Thank you everyone who is watching us. At the moment, we will be starting in a few minutes here. Okay, so it looks like a few more people joined us. So we're going to go ahead and get started here. Okay, well, thank you everyone for joining us today in the COVID update. Again, my name is Stephanie. I'm the communication specialist. Hola a todos, gracias por acompañarnos hoy en nuestra actualización de COVID-19. Vamos a tener esta actualización en español la próxima semana, que sería el 1 de junio, aquí vivo en Facebook a las 6 de la tarde. So we are continuing our vaccination efforts here in Yakima County. And the site here at the Community Vaccination Center at the Yakima State Fair Park will continue to remain open. I'll provide in the second half of this update a few details for individuals and information on any updates as well. And this evening, tonight, we have Dr. Yeka, Interim Health Officer at the Yakima Health District, joining us today to speak a little bit more about the masking guidance as well as vaccines. And we will also provide more information on the mobile locations that are occurring throughout the week too, and any other updates on the Community Vaccination Center. So if you have any questions on vaccines, the CDC guidance for fully vaccinated people, or the Community Vaccination Center, or any of the mobile vaccine locations, please make sure to leave them in the comment section, as I will be monitoring it on Facebook. And if you have any other questions outside of these topics, please feel free to leave those there as well. We'll try to address those in tonight's update. Alrighty, and then to begin, I do want to start off with giving everyone an update of how we are doing in terms of vaccination. So I'm going to go ahead and try to share my screen here to show the individuals who have initiated vaccination and have been fully vaccinated in Yakima County. Okay, perfect. And I think you're all able to see my screen. So it looks like in Yakima County, out of the individuals who are 16 and older, 51.2%, 51.72% have initiated vaccination. And of individuals who are 16 and older, 43.41% have been fully vaccinated. So we're still seeing individuals in Yakima County continue to get vaccinated and continue to take advantage of all the opportunities of vaccination that are occurring throughout our county. So that's great news, and we want to continue encouraging people to get vaccinated, take advantage of all those great opportunities, as well as remind people, if you got your Pfizer or Moderna vaccine, that it is important to get your second dose, as they do require a 2-dose series, and then you will be able to be considered fully vaccinated 2 weeks after your second dose of the Moderna or the Pfizer, or 2 weeks after the single dose of the Johnson & Johnson vaccine. Alrighty, so great news. We'll have to keep up the work. And Dr. Yeka, would you be able to tell us a little bit more, maybe to start off with the new masking guidance for fully vaccinated people?
Sure, I'd be glad to do that. But before we do that, I'm going to thank all of you that have been vaccinated and are being vaccinated and helping protect yourselves and others. and it'll do a lot for us to get forward and get this COVID behind us. So, but yes, there are new guides. We found out the vaccines are so effective in people that are fully vaccinated that Centers of Disease Control looked at the science and said, you know, uh, these people should be rewarded, and rightfully so. They're not at risk, and they're not risking others. So the masking guidance is changing rapidly, and it changed with CDC, and then the state has new guidance, and the State Department of Health, the secretary, uh, has just iterated and made more masking guidance. So essentially, people that are vaccinated are a lot more lenient as far as not having to wear a mask in public, unless in places that are posted is still the hospitals, doctors' offices, long-term care, and something like that, and the schools. They still have the masking policies, but going out into businesses and everything is kind of up to the business. If and meeting with family and friends, and that if everyone's vaccinated, you're free to enjoy back to a more normal life. So if you have any questions, just feel free to ask them specifically. There's more guidance on the website. You can get it, and Stephanie can tell you how to do that.
Perfect. Thank you, Dr. Yeka. And it looks like we do have a question from Alexandra. Alexandra asks, my question is, if you're fully vaccinated, do you have to wear a mask on the bus?
On transportation, yes, because that's still one of those, I think anyway. Yes, transportation is still buses, airplanes, all those. I remember, yes, they are still required.
Perfect. Thank you, Dr. Yeka, for all that information. Let me go ahead and check to see if we have any other questions. So I can go ahead and ask a question.
Okay.
So if I'm not fully vaccinated, what does CDC guidance mean for me? For individuals who aren't fully vaccinated, what does this new guidance mean for them?
Okay, the new guidance is only for those fully vaccinated. It means 2 weeks after your second shot of Pfizer or Moderna, or 2 weeks after your Johnson & Johnson, the one shot dose. So we after one dose, you get some pretty good protection, especially against getting disease, but you can still come down with the disease and pass it on. So we want to make sure you're fully vaccinated before we start thinking about unmasking.
Perfect. Thank you, Dr. Yeka. And then I know with individuals who are 12 years and older, they are now eligible to receive the Pfizer vaccine. I know parents may have more questions, such as, why should I get my child vaccinated against COVID-19? Or is it safe for my child to get vaccinated? What information could we provide the parents?
Well, there's been a lot of testing in this individuals, and the FDA didn't just warrant it to give it out, because there's good evidence that is very effective in children over age 12, and it gives very good protection and protecting against the disease. The disease isn't as severe in children, but it is in some. It is, and it's just not. Having a light case of COVID, we're finding out there's some long-term sequelae that we're seeing from some of the kids. So we can't really just poo-poo. It's nothing in kids. Diseases can always be significant. If you're the one that especially has a bad side effect or something like that. So it's very encouraged in kids. It's safe. It's been proven. And if you have questions, ask your physician, ask your healthcare provider, your nurse practitioner, your PA, and get their advice.
Thank you, Dr. Yeka. And then let's see if we have any other questions from Facebook here. So it looks like we have a question from Chris. We don't have that information at this moment, but we'll definitely update you on that one. And let's see, do we know how long the protection from a COVID-19 will last?
No, we don't. They're studying that now, and we suspect, we know it's going to last a year. I'm pretty sure we're okay for a year. And after that, we'll start knowing, because the first testing that they did with this years coming up. So from over the next few months, we'll be able to tell more whether we're going to need a booster every year or just how effective the vaccine is. So stay tuned. We'll have your answer later.
Thank you, Dr. Yeka. And thank you for providing us always with the information on masking guidance, vaccines, any questions parents may have, common concerns from the community, or any myths. And we'll continue to provide these updates for individuals to get the most up-to-date information. Alrighty, and then another thing that I would like to clarify in the community too is, should individuals who develop COVID-19 symptoms, regardless of vaccination status, still get tested for COVID-19? Is that still important to get tested if you developed COVID-19 symptoms?
Yes, it is, because there are some breakthroughs, and we need to know that. So yes, if you get the COVID symptoms, especially now, because we're not in upper respiratory infection times, and so more than likely it would be COVID. So get tested so you can still quarantine yourself, isolate yourself, and protect the others.
Perfect. Thank you, Dr. Yeka. And I'm going to check another time to see if we have any other questions on our Facebook. Okay, perfect. It doesn't seem like we have any questions, but we do encourage any of you that are watching us to please ask your questions. We do have Dr. Yeka here, who will be able to answer questions relating to COVID-19 or any of the masking guidance that we were able to touch on earlier in the COVID update. Okay, so I can go ahead and talk more about the Community Vaccination Center. Dr. Yeka, did you have anything else you'd like to add?
No, we have loosened the guidance, but I've noticed people are used to wearing masks and they want to be protected. And that's not a bad thing. Just because you've had your vaccination, if you feel safer wearing the mask, they're very effective. In fact, it's groundbreaking. We had no flu season this year. And even the rhinovirus season was very little. So the masking has really stopped upper respiratory infections over our winter. And so it's not a bad thing to wear masks. It's, and so it'll be interesting how it evolves over the next few years, because as we know, other parts of the world, mask wearing is fairly common during the upper respiratory season. So don't be afraid to wear a mask if you feel it, especially if you feel uncomfortable and you just want to feel safer. It's not a bad thing either.
Thank you, Dr. Yeka, and thank you for providing that update. I know a lot of individuals were thinking of that as well. Let me go ahead and share my screen, and I will provide more information on our Community Vaccination Center here and the mobile units that are occurring throughout the community as well, and where individuals can find that. Okay, perfect. Can you see my screen? Okay, so if individuals would like to get more information on mobile vaccine locations, more information on the Community Vaccination Center, you can go ahead and go to yakimavaccines.org, and there we will have all the information for individuals Here at the Community Vaccination Center, we're open 7 days a week. However, beginning on Thursday, we will have new hours of operation. Those hours we will be open 5 days a week now. So Friday and Saturday will be closed. Then on Sunday, Tuesday, and Wednesday, that'll be from 10 a.m. to 6. And then on Mondays and Thursdays, it'll be from 10 a.m. to 8 o'clock p.m. So there will still be availability later on in the evening. And in addition to the Community Vaccination Center, we will also continue to have our mobile units. So it looks like for today's mobile units, we did have 3 locations: Sela, Gilbert Sellers, and Hoover Elementary. And if you're watching us now, it looks like Sela High School is closing at 6:30. So you still have a little bit of opportunity to go get vaccinated. And then for tomorrow, there's also lots of opportunities at West Valley High School in comprehensive healthcare. And then we will continue updating this page so we can have to update the community. There will be mobile locations throughout the week. So that's also great opportunities to get vaccinated as well. So we're definitely encouraging individuals to access the yakimavaccines.org page to get more information on that. Alrighty, and then another thing that I did want to mention too is that this month is National Mental Health Awareness Month. So we want to encourage individuals to continue taking care of their mental health. It's just as important as their physical health. And I also wanted to share with you a tool that the Yakima Health District has that will be able to provide more tools to help with anxiety, stress, depression, sleep quality, and other areas of life that can be challenging, as well as you individuals can also call the 211 number to find a local provider near you as well. They'll be able to help you find a provider. So that tool that the Yakima Health District has is called the My Strength app, and it's available in both English and in Spanish and open to anyone 13 years and older. And it's intended for individuals who live or work in Yakima County. And there's a specific access code which individuals can use, and it'll be free for them to use. So I'm going to share my screen one more time to share where individuals can find more information on that. Give me 1 second here. Okay, perfect. So if you go to our Yakima Health District page and scroll down, you'll find this icon called the My Strength. And if we click on that, you'll receive a lot more information on how to sign up. And it's easy to sign up. You can just visit My Strength, click sign up, and then you will enter the access code. And the access code is Yakima County. So there we will find a lot of information on how to access the app. It's a great resource for individuals. And we wanted to, again, remind the community of that opportunity and resource for them. It offers programs that helps you set your goals and tracks progress. It also includes hundreds of inspirational messages. And again, it's available in both English and in Spanish. So it's very important for individuals to continue taking care of their mental health, not just this month, but every month and day after. So we encourage individuals to take advantage of that opportunity. Alrighty, let me go ahead and check our Facebook to see if we have any other questions. Give me one moment here. Perfect. Alrighty, and then Dr. Yeka, is there any other information you would like to share with us today?
You know, the good news is vaccinations really work and they're helping us getting back to normal. And so I encourage you to, if you're procrastinating, setting on the line, really think hard of the benefits that you'll have from being vaccinated for yourself and others. Remember the people say, oh, you know, there's side effects of vaccine. Well, the side effects of COVID are much more serious than any side effect from any vaccine. So take that in mind. COVID can be very serious, and we're still seeing deaths in our county from it. So that's the stark reminder that it is a deadly disease too. So get vaccinated. Thanks.
Thank you, Dr. Yeka. And while we're on the vaccination topic, I did want to share my screen again to provide information on how we're doing as a state. I know Governor Inslee has said if we do reach 70% of individuals who had initiated vaccination before June 30th, then we can open up sooner. So just wanted to provide individuals an update to see how we are doing here. Okay, hopefully you all can see my screen. So it looks like in Washington state, of individuals who are 16 years and older, 60.91% have initiated vaccination. So we are definitely close. We're still encouraging individuals to get vaccinated. And in Washington state, of those who are 16 years and older, 50.78 have been fully vaccinated. So we're continuing to do work together as a state. So we're encouraging individuals to do their part, get vaccinated. Thank you to those who have been vaccinated, like Dr. Yeka mentioned. And we also want to continue seeing our percentage of individuals who have initiated vaccination and have been fully vaccinated increase also in Yakima County. So please take advantage of all those great resources. We want to open up sooner to support all our local businesses. So we all want to continue to do our part to remain safe and open up sooner. So great news, keep up the good work. Okay, well, I think that'll conclude our update for tonight then. Thank you again, Dr. Yeka, for joining us on today's update. And we will see you all again in our next update, which will be on June 8th, and it'll be the same time, 6:00 p.m. on Facebook. And for those who speak Spanish, gracias por acompañarnos hoy. El próximo martes, el 1 de junio, tendremos esta actualización en español a las 6 de la tarde. And again, Dr. Yeka, thank you so much for your time and for providing us and all the community and everyone watching us all this valuable information about masking guidance, COVID-19 vaccines, and any updates that we have for the community.
Thank you. Good night.
Thank you. Have a good night.